UNDP, Mr. Mark Barone, founder and general manager of Brazilian Intersectional Forum on NCDs, in your presentation on what the political determinants on NCDs mean for people living with NCDs. And I note that somewhere in your presentation, you will mention tangible impacts its commitments will have for NCD care if, and this is an important if, implemented to its full extent. I guess that's what we're here to address today. Mark, over to you.
Thanks a lot. Good afternoon. First, I would like to thank all the organizers and partners for bringing us together here to this important discussion. I'm speaking today not only as a civil society representative, leading FórumCCNTs in Brazil, where we bring together 250 organizations from public, private, and not-for-profit sectors to improve the landscape of NCDs in the country, but also as a person living with type 1 diabetes for 35 years and other NCDs, and member of several communities and groups of people living with health conditions. For me, financing for NCDs and mental health is not abstract discussion. It is about survival. Every single day, people are dying from conditions that we already know to diagnose, to treat, and to control. Children are still dying because of type 1 diabetes is not diagnosed in time. Children are still dying from asthma because essential medicines are not available. Women continue to dying from cervical cancer despite the existence of HPV vaccine and screening tools. People with chronic diseases suffer severe complications because they cannot consistently access insulin, cancer care, or medical health services. And many families are pushed into poverty simply because someone developed an NCD. This is why the 2025 political declaration matters, because if fully implemented, it can change this reality. Two commitments are especially critical. First, ensuring that by 2030, at least 80% of primary healthcare facilities have affordable essential medicines and technologies for NCDs and mental health. Second, ensuring financial protection mechanisms so people can access care without financial hardship. These are not technical targets. These are difference between life and death, between community of treatment and avoidable complications, between dignity and suffering. And importantly, this declaration goes beyond broad intentions. It includes concrete commitments on price transparency, pool procurement, local production, stronger regulatory system, and technology transfer. These measures can dramatically reduce medicine costs and expand access. But implementation will only succeed if we all guarantee meaningful engagement. Meaningful engagement means that people living with the conditions affected by a decision must participate in making that decision, not symbolically, not occasionally, not systematically, and we must also move beyond fragmented approaches, because people do not live in silos. A person may live with diabetes, obesity, hypertension, depression, or cancer at the same time. Health systems must become implemented and truly people-centered, because universal health coverage will only become reality when access to NCD and mental health care also becomes reality. And finally, while the declaration establishes important targets on hypertension, tobacco, and mental health, we must also advance other global commitments, including Global Diabetes Compact targets, vaccine coverage goals like HPV and influenza, because without implementation across full continuum of prevention, diagnosis, treatment, and protection, prevention deaths from NCDs will continue happening every day. Preventable deaths, will continue happening every day. The solutions already exist, the medicines exist, the knowledge exists. What we need now is political urgency matched by sustained financing and accountability. Millions of people living with NCDs around the world can't wait. Thank you very much.
Thank you.